I'm Angela Lober. I am the lactation lady of Edson College. Thank you. I run a program called the Academy of Lactation Programs, where we seek to provide enhanced learning opportunities for people to become lactation consultants or add it to their practice. We have 3 on-ground clinics where we provide support to the community free of charge without limit, and our interns and our students get to learn what that is like. We center infant feeding. That is the primary focus of our training and our education. However, we can't do it without all of those other things. Out of an hour-long consult, we spend maybe 20 minutes on actual feeding, and the rest of the time is spent on all of those other things, especially perinatal mental health. We have realized that lactation care is the place to capture everything else that's going on with the family, because they won't see their OB for 2 to 6 weeks. When they go to the pediatrician, they just want to talk about the kid. When they come to us, they tell us everything. So we have an opportunity to support families in a very holistic way. It all follows under the grand umbrella of maternal child health. And for many years, we have been doing our work in silos as much of healthcare is done, right? There is the infant feeding silo, the mental health silo, the pediatric, the OB, the housing security, the food security, and we were all doing a great job, but we weren't really working together. Maternal child health right now is at this beautiful point where we are networking together, and it is changing the landscape quickly. And we at the Academy of Lactation Programs realized we needed to be a part of that network. Sadly, I am not a natural networker. I'm a little bit socially awkward. If you know me personally, you know that this is true. And I don't do the small talk thing very well, but I knew I needed to get out there, and I needed to get the program in front of people. This is Lakeisha Muhammad. She is the founder and CEO of Arizona Birth Workers of Color. It is surprising how separate birth work and lactation or infant feeding support have been. Now we're starting to mesh together. That's just a side note for you. I have found a strategy that has helped me network and make community connections and community partnerships. It's just my strategy, but maybe it'll work for you. I'm hoping that somebody will benefit. That's where we are today. It's a super easy 3-step process that requires a lot of internal work and a lot of work out in the community. The first step is understanding your mission and vision. Your personal one, if it's appropriate, your facility, your institution, making sure that those things are aligned. Your mission is what you stand on and what grounds you. This is why I'm here. I say, and I have been a lactation consultant for nearly 20 years, and I have said, aside from my own children, my own family, this is why I exist on the planet. So know what you're standing on, and then your vision is, where are you going? Where do you hope to go? Once you understand that, then you find the tables with other people who share a similar mission and vision. And imposter syndrome is real, it's critical, it can shut you down, but just get to the table. Get and pull up to the table, not at the back of the room, but sit at the table. If you have a strong mission and vision, your voice needs to be heard. You need to work with other people who are doing the work. So come back always to your mission and vision, sit at that table, and then connect. Connecting is challenging because in a group like this, we might meet other people who are aligned with us and we want to do work together, but I'm not going to see you again in person until the next time this event happens. It is the digital age, folks, and business cards are great, but we have to be digital. That is an actual picture of the front of my phone. Feel free to scan that QR code right now if you'd like to. I can get my phone is not connecting, but that is my actual phone. If you scan that QR code, I'll give you just 1 second. If it works, maybe the screen is too light. I'll give it to you later with my actual phone. It goes to this app. It's called Blink. There are other apps that you might like better. I love this one. You get 2 profiles for free. If you scanned it, you now have all of my ASU information. You have my name, you have my email address, my phone number, our website, our Facebook, our Instagram. It's better than a business card because now you can see everything that we're doing in the community. having a social presence, a social media presence, is important for people to take you seriously. They need to see you doing the work so that they know they want to continue to partner with you. The third thing that we've gotten our mission vision, we've connected, now we have to show up. And I go to a lot of health fairs. That's how I meet most of our community partners. Go up and I keep my social awkwardness contained by standing on my mission and talking about my vision. So I connect with other people. I show up wherever I'm asked to show up. So I'm going to put this into context of how this actually worked for us. Our ASU Academy of Lactation Programs mission is to provide an enhanced learning environment for our students and interns. Our vision is to promote breastfeeding and infant feeding, human milk feeding, as an act of social justice and health promotion. Lactation is one of those things that is still undervalued, under-researched, and under-researched because it has to do with a body that has breasts. And we know that anything that has to do with a body that has breasts is under-researched, underfunded, and undervalued. So we're still in that place where we're fighting for it to be taken seriously. So that is the mission and vision of our place. We aligned with a lot of other people who have the same mission and vision. One of them is Canyon Pediatrics. They have 2 spaces in the East Valley, one in Gilbert, one in Mesa. They invited us to come in for free to provide lactation services to not only their patients, but anyone who showed up. We said yes, we showed up. There we are showing up. So, so that's off of our Instagram page. I had to get very comfortable with doing social media. I do not like being photographed. I do not like this is okay for me, but I don't like getting my picture taken. I had to get over that real quick and get on social media. So here, and then we take our students in, we teach them everything that we concentrate on for maternal child health, centered on infant feeding. At Canyon is this lovely and beautiful person. Her name is Ashley Brubaker. She's one of the owners of Canyon. That middle credential is perinatal mental health certified. So as we started talking, they just wanted us there for lactation support, but as we started talking and we're saying we identify a lot of mental health issues, we worked out a direct line so that when we identify something, we take them directly to Ashley. Sometimes she's in-house. If she's not, she contacts them within 2 hours. We have caught people, we do Edinburgh postpartum depression screen for every patient. The highest score is 20. We have caught people at 15, 16, 17, 18, which is critical and almost worth hospitalizing. She takes them and she carries them the rest of the way. Okay, so this is the story of Claudia. Of course, that's not her real name, and this is not her picture, but this is just a stock photo, but she did ask me to share her story so that, in case it helps anybody else. So the story of Claudia is that she had a 36-week baby, which is preterm, stable enough to go home, but immature and doesn't eat well. Her pediatrician followed them. They were very well managed, but the pediatrician referred them to us for feeding support. We do what we do. We gave them a supportive and integrative feeding plan. It was a stepwise program so that every week she's coming back. There's us. We were there. we came in, and her husband was home with her for a week. Then he goes back to work. He works 12-hour shifts. They had recently moved to Arizona. She didn't have a lot of connections. They live in a small apartment with windows only in the bedroom. She spends her time in the living room. No windows, a lamp only. As her anxiety started to grow and grow and grow over this baby who wasn't eating well and growing slow, and the pediatrician is worried, and she's coming to us. On her Edinburgh, she was still scoring low, which can be a thing when people don't want to totally see what's happening. So it was scoring low. We decided that, maybe you need more support. We asked her, can we refer you to the lovely and beautiful Ashley? And she said yes. We connected with Ashley. Ashley started doing her perinatal mental health sessions, some counseling sessions. Ashley referred her to a provider that diagnosed her with perinatal mental health disorder, which is an umbrella term for depression, anxiety, and OCD, and she definitely demonstrated all 3 of those. Claudia declined medication intervention. We connected her with the Fourth Trimester, which is a large organization across the state, Fourth Trimester Arizona. They have a feeding village right there at Canyon. They have different villages all over, which are like support groups, but people don't like the word support groups. I don't like it. They're called villages. And so she comes to us. We are there as well, so that anybody who needs extra support, we can be there to help them. Fourth Trimester connected her to a larger group of women who now she is able to go out with and meet weekly or meet virtually. She's connected to a larger group of people that are all saying, I'm going through that too. I get it. And so she has a wide network. Our students, our interns, our clients experience in-time collaborative care. And it all begins with connection and community partnerships. Thank you.